right now, make sure yes, we are recording. Want to introduce Ms. Debra Weinberg, my coworker at Disability Rights Louisiana. She's our Director of Community Advocacy and will be my co-presenter today. Debra and I are going to share information about COVID-19 for people with disabilities. And so with that, Debra, do you want to get us started?
Great, let's get started. Okay, so just as kind of a background on this, who are we? Here, we're called Disability Rights Louisiana. If you knew us more than about 3 or 4 years ago, we used to be called the Advocacy Center. We are a statewide organization in Louisiana with the goal of protecting, advocating for, and empowering folks with disabilities all across the state. We actually do this with a federal mandate, and there's an organization like ours in every state and territory in the United States. We are presenting this and providing all of the information we're providing regarding COVID-19 and vaccines through a joint effort with the Administration for Community Living, which is a federal organization that is partnering with us to help provide critical services to help communities combat COVID-19. So as we go through this today, we're going to be talking about a lot of data, a lot of information. And so we just want to let you know that the information we're providing today, for the most part, is coming from the CDC. The CDC is our national public health agency with the goal of protecting the public health and safety through controlling and preventing disease. Okay, so I know when COVID comes up, there are a lot of feelings people have and a lot of different things people want to discuss. But for today, what we're really focusing on are the facts and what you can do about them. So we're going to start off by talking about the fact that COVID-19 is still very much here and part of our communities. We're then going to talk about how to explain COVID-19 in plain language and provide other accessible resources about COVID-19 and COVID-19 vaccines to individuals with disabilities. We're going to highlight the Disability Information and Access Line. We're going to talk about LDH's in-home vaccination program. And then we're going to finally talk about resources, especially those from COVID.GOV, but also from some other locations about COVID-19 generally and vaccines, masks, testing, treatment, ventilation tips, long COVID, and lots of other information available for people with disabilities in regards to the COVID pandemic. I'm now going to actually hand this off to Kevin and let him take us into a discussion of COVID.
Thanks, Debra. As you mentioned, unfortunately, COVID-19 is still with us. You can go, first I'll talk about the CDC.gov's website. There is a ton of data on this website. We could talk all day about just what's on the site and navigating through all the menus and everything, but we're really trying to pull out information for people with disabilities. First and foremost, this page you see here that shows community transmission levels. You can get to it through the CDC.gov's main page, and it shows, this screenshot was taken on Friday, but you see parishes in the red are at high level, orange are at a substantial level, yellow are in the moderate, and you see most Louisiana and the country is either in the red or orange. So unfortunately, rate of transmission is still high. We're going to talk about more information about how to help with that. At cdc.gov does pull aside some information geared specifically towards people with disabilities. So we want to highlight that here. First of all, there's a toolkit for people with disabilities, and it's just communication information and other info that's geared towards people with disabilities. And I included the links at the bottoms of these pages. We're going to post these and archive these on our website. So if you miss anything, if you miss a link, we're going to try to get this posted as soon as possible. But just to let you know where the information is coming from and where to go for more details. So there's that toolkit for people with disabilities. There's COVID-19 materials for people with intellectual and developmental disabilities in plain language. And we're going to elaborate on that in a minute. But to go to that site too, there's also, I don't know if there are any professionals here, anyone who knows anyone who are in these programs, but there is guidance for people who operate adult day service centers, guidance for direct service providers, guidance for home visitors, people who might go, there might be therapists or healthcare workers who go into the home with other people who might be at risk. And lastly, building capacity for inclusion of people with disabilities. That's geared towards emergency providers and people with like evacuation plans and work plans, things of that nature. But wanted to let you know that it was all there on cdc.gov. There's a ton of information there, but it might be helpful towards you and people you know if you're watching this presentation. There's one page we get a lot of questions. There's a lot of talk in, especially in the disability community, about people who are immunocompromised being at higher risk of COVID-19. At the link, I've included the link below from the CDC that talks about this in a little more detail, mentions that some people who are immunocompromised, who have a weakened immune system, are more likely to get sick with COVID-19 or be sick with a longer period. So there might be types of conditions or treatments that cause this. I encourage you to go to this website and for more information, or ask your doctor, and see how that can help you come up with your plan. Some more information. The section I just mentioned is materials for people to communicate with people with intellectual and developmental disabilities that are in plain language. So this part of the site has some very basic information that might be communicated through plain language or pictures. That might be a better way of communicating if you or somebody has a disability, and this might be more appropriate. So there's materials that are also available in Spanish that talk about getting the COVID-19 vaccine, about washing your hands, getting a test, wearing a mask, and keeping a safe distance. And I'll show you, here's just an example. Here's one of the pages from, there's a presentation, I think it's about 12 or 13 pages of things like this that might be more appropriate depending on your needs. So I encourage you to look at that section of the CDC website. We also have this type of information on our website. We've put together some resources in plain language, information in ASL, including videos in ASL, mental health resources for people with coping and stress management for COVID. But that's not really the focus of this presentation, but we did want to include, there's a link right there at the bottom of the page. And if you scan that code with your phone, if you take a picture of it, it'll bring you to that page on our website. So wanted to mention that as well. And of course, this presentation that's where we'll post this when we get this archived as well. So I'm going to give you a heads up that. And then that presentation, as we mentioned at the top, there is a hotline that is very helpful for people with disabilities, and it's run through, we mentioned ACL at the top of the program, who funds this grant. It's the disability, and they're part of the our U.S. government health department. This is the Disability Information and Access Line, or DIAL. They can help you schedule an appointment for vaccines. They can help you find transportation. They can help you overcome any kind of barriers related to disability that might prohibit you from getting a vaccine. So their number is 888-677-1199. You can call them Monday through Friday, 8 a.m. to 7 p.m. Central. We also included a link to contact them on their website. Not only do they have this helpful information and can help you with transportation to vaccines, but their staff is trained to communicate with people with disabilities specifically. So they have that training, but they also have these access lines where you can email them, you can go to their link, you can go to their website, which is acl.gov/dial. There's also a number for people who use TTY. You dial 711 and then the number on screen 888-677-1199. Again, this hotline, it's specifically geared towards people with disabilities. It can help you with transportation, finding vaccines, but also some questions about vaccines and maybe other barriers as well. They can connect you to other support agencies in your area. So to make sure to mention this, since it focuses on people with disabilities, again, 888-677-199, the dial hotline. So another great thing that's out there is specific to our state. Louisiana Department of Health has a program to vaccinate people in their homes. So this is great for people with disabilities, but also any people who can't leave their home for any reason. So even if you might have a broken leg and it's not considered a permanent disability, this is for people who need a vaccination in home. So you can call their hotline 1-855-453-0774. Their website, ldh.la.gov/in-home shots. And we have all this information on our website. It's already up there, but it'll also be there as part of this presentation. And similar to Dial, they also have specific lines for people with different needs. So you can call them by phone. You can go online and book your appointment that way at the website that I just mentioned. You can call their main line and ask for someone to speak Spanish or Vietnamese. Or for callers who are deaf or hard of hearing, you can coordinate with Louisiana Commission for the Deaf at 800-256-1523 by voice, or by video at 225-228-1203. So in addition to those programs, the CDC has a special section on their website called COVID.GOV. And this is kind of a one-stop site to connect you to resources around the tools to help you deal with COVID-19. So you'll see this number all throughout the presentation, even on the different sections of their site. The main number is 1-800-232-0233. And they do have a line accessible by TTY, and that is 1-888-720-7489. And again, all of this information I'm about to cover is under the website COVID.GOV, and you can go through their menus that way, but I'm about to tell you how you can get specifically to each section of the site and what they entail. Really covers information about how to access vaccines, masks, testing, treatment, and ventilation tips. And there's also some tips about long COVID, which we'll get to it at the end. But those are really the 5 tools that are featured on the website to help us fight variants, to help fight COVID-19 on all fronts. So I'll go into each section here. And then we put them all together on one page. This is on one of our Facebook pages mentions this. This is also on our website. So if you don't catch this link, just you can catch this on our website, but it features that main line again, and each section has their own website where you can get directly to that kind of information. So I'll go into a little more detail about that. Vaccines.gov, you can go right to that site and find locations around you that are offering appointments for the vaccine. That's how I got my booster a couple of weeks ago. Vaccines.gov, I found a Walgreens that was nearby that had appointments and booked it online. You can also text your zip code to 438-829 or call that main number featured throughout, 1-800-232-0233. In addition to vaccines, there's good information about masks on COVID.gov. Mentions how masking is a critical public health tool. It's important to remember any mask is better than no mask, but if you can wear the most protective mask you can that fits well and that you'll wear consistency as the best option. Wearing a high quality mask along with vaccination, self-testing, physical distancing, helps protect you and others from the risk of spreading COVID-19. And so there's some more information about how to find free mask programs. Now this website does not show the availability of free masks, but it does show locations that have participated in this program. So if you go to the website that's shown on the page or call that main number, they can tell you some more about who's participating. And then you would call that facility, they tell you the Walgreens on such and such street, you would need to call them to make sure they still have free masks, but the program is still being advertised on the CDC's website. So I wanted to pass that along. There's also information about testing. You can still order tests through the mail to be delivered to your home that are designed to be more accessible to people who are blind or have low vision. And you can do that at the website. I know there was a program that expired on September 2nd, I believe, but this program is still available and is still being advertised, but supplies are limited. So if you are not in need of a low vision accessible test, you may want to consider that the supplies are limited there. So you can find those at that link, but you can also find locations where you can go to get tested for COVID-19. So that link at the bottom of the screen is where you go on to find those locations. And then treatments, you hear it a lot. I've seen commercials already for treatments for COVID. You can, again, call that main number, 1-800-232-0233, to find locations that there are places that do test to treatment where they do both. But there's also just places where treatments are available at pharmacies and health clinics, other locations. And so there's more information about that on screen. Try to get them as soon as possible. And there's also information, I mentioned it earlier in the program, about people who are immunocompromised. Some people might have a condition which makes them allergic to the COVID-19 vaccine, or it might make that vaccine ineffective. Go to that link and talk to your doctor for more information about EvuShield, which is an alternative to the vaccine for people who are moderately or severely immunocompromised. Again, that's link is on the page, and the number 1-800-232-0233 for more information on that. And there's a little more information in the program on this about treatments. Again, reiterates treatments can help reduce the risk of chances of hospitalization and death once you contract COVID-19. The sooner the better. And again, visit that link for more information and talk to your doctor. And then this page also kind of mentions who is more at risk, which is people age 50 years or more, people who are unvaccinated, people with certain medical conditions, chronic lung disease, heart disease, weakened immune systems. Being vaccinated still makes you much less likely to get sick, but some vaccinated people, especially those 65 years or older who have other risks, may benefit from this treatment if you contract COVID-19. So as it mentions, a healthcare provider will help decide which treatment, if any, is right for you. And on the page mentions that there are antiviral treatments and monoclonal antibodies, and more information is on that website. And again, talk with your healthcare provider for more. And then another tool on COVID.gov, and I'm a big fan of this, ventilation tips. This mentions that small particles that people breathe out can contain virus particles, including the virus that causes COVID-19. So if a guest visits your home, improving the ventilation or the airflow in your home can help prevent the virus particles from accumulating in the air. And good ventilation and can help prevent you from getting and spreading COVID-19. So on that website, there's a really neat interactive tool where you can click, and you can there's some menus where you can indicate the type of if you have HVAC or ceiling fans. You can type in how large your home is, how many rooms you have, things of that nature, and it'll give you some tips on improving your ventilation, and also some basic tips on ventilation in general, which we mentioned here. You can open windows, use air filters, turn on fans, all help with ventilation. And the two things that it mentions here, ventilation and filtration, are the keys. Ventilation is what moves air into or out of or within a room. So as mentioned above, bringing fresh outdoor air in and out of the room is helpful. Opening doors and windows, using fans. And then for filtration, there are other methods. And, we have, in my office, I have, I think in all of our offices, we have HEPA filters, which stands for high efficiency particulate air cleaner. Basically filters out the air of particles, which includes potentially COVID-19 virus particles. So those HEPA filters are very efficient for dealing with particles that people exhale and breathe and talk, in the room. It keeps them from accumulating. So also information about you can turn on the exhaust fan in your bathroom and kitchen, and use fans in your house, and limit the number of visitors that come in and out of your house. Gather outside wherever possible. Tips like that. But you can see more at the CDC's website. You can get to it through COVID.gov, but also you can get through it directly through the link that I've included here. So with that, I'll turn it back over to Debra. There's more tips on that site, which I just mentioned about long COVID. So Debra, you want to talk more about that?
Sure. So I have a feeling most of us have probably heard about long COVID. So long COVID really is talking about people who, after they have had COVID, experience long-term effects from their infection. For more information about that on COVID.gov, the link is on this page. So, as a lawyer, we're not just looking at COVID as, something that exists, but also kind of what the legal implications are. So long COVID has been considered a disability if it substantially limits one or more major life activities. So what that basically means is if long COVID makes it so substantially limits your ability to stay awake, your ability to learn, your ability to work, those are all things under which long COVID could be considered a disability. And if that's the case, then it is covered by the things like the Americans with Disabilities Act, Section 504 of the Rehabilitation Act of 1973, and Section 1557. And that basically means that not only can you not be discriminated against because of long COVID, but also that in certain situations you have a right to reasonable accommodations or modifications. So the CDC put together kind of a little fact sheet on what you need to know. They call it post-COVID conditions. When people talk about that, it's usually similar to long COVID, and they can be anything from a couple of weeks to months or longer. And yeah, contrary to some popular belief, you don't have to have had a intense or bad case of COVID to get long COVID or post-COVID conditions. People who are not vaccinated might also be at higher risk of post-COVID conditions. And the CDC is still working to put together more information on this. Obviously, COVID-19 has only been around for, I think, about 2.5 years now. But these conditions can include all sorts of, physical symptoms, and definitely talk to your doctor if you are feeling like you have conditions post your COVID infection. And as I was talking about before, some people with long COVID may be entitled to workplace accommodations. The Department of Labor has a blog that kind of goes into some kind of common questions and answers on this, and it's at that link below.
Whoops.
And finally, the Civil Rights Division of the Department of Justice on its Americans with Disabilities Act page actually has put together topics related to COVID-19 and the Americans with Disabilities Act. Also, remember, if you do have concerns about how you have been treated due to a diagnosis of long COVID, or just questions about access to vaccines, or other COVID-related needs, do please feel free to reach out to us here at Disability Rights Louisiana. You can reach us by calling 1-800-960-7705 or going to our website at disabilityrightsla.org. That's DISABILITYRIGHTSLA.org. Or follow us on Facebook, Instagram, LinkedIn, or Twitter. Does anyone have any questions?
I don't see anything in the Q&A right now. If anyone has any last minute questions, you're welcome to ask. As I'm waiting for that, I do want to mention we have another Lunch and Learn webinar this Thursday at 11 on employment issues. Our interim executive director, Ronald Laspinato, will be presenting on that. Thanks so much to everyone who came and viewed this presentation. Thanks again, Janice King, New Orleans Sign Language Services, for providing ASL interpretation. Thanks to my co-host, Debra Weinberg, our Director of Community Advocacy. And yeah, please visit our website, as mentioned, disabilityrightsla.org. Try to get an archive of this presentation up as soon as possible. You can visit our resource guide that has this information and other helpful links. So thanks again, everyone. I'll see you next time. Take care.
Thank you all.